We have selected a couple of abstracts from those presented at the EASL this year to show how alcohol and other sources of fat accumulation in the liver can contribute to chronic liver disease. And I've just reported here a few notes regarding the background. So these are notes deriving from a recent publication from EASL on the burden of chronic liver disease in Europe that show that Europe is the heaviest drinking region in the world in terms of the prevalence of alcohol consumption. We have over 20% of the population of 15 years or older that reported a heavy episodic drinking at least one time per week. And alcohol consumption is the third largest cause of early death and illness behind tobacco and high blood pressure. And from the early 70s to the 2000 in England, there was a tenfold increase among women aged between 35 and 44 dying from liver cirrhosis. So the first abstract that I would like to review with you today will be presented on Saturday by Dr. Trembling. Has been conducted in UK and is a good example of a population study. The authors assessed the incidence of liver-related morbidity and mortality in a population of women between 50 and 75 years old. They evaluated the risk of liver-related events due overweight or obesity or alcohol consumption and investigated the interaction between these conditions and alcohol consumption. They studied a large amount of women, more than 100,000, that participated in this UK CTOCS trial, which is a screening program principally aimed at investigating ovarian cancer. They observed during the follow-up more than 600 first events of cirrhosis and liver decompensation over a median follow-up of about 10 years. And the standardized event rate was 0.06 events per 100 participating years. The multivariate analysis showed that the risk of event is increased by both alcohol and BMI, and that the risk of both conditions, so heavy drinking and obesity, is actually synergistic. So the authors conclude that alcohol and overweight or obesity are both risk factors for liver disease, and the risk of liver disease is further increased when both risk factors are present. And they also argue that this data may help to shape better public health messages aimed at reducing incidence of liver disease. And there is also a need to better set the proper thresholds alone and in combination able to prevent liver disease. The second abstract has been presented by a French group, Dr. Pais from the FLIP Consortium, which is actually a research group endorsed by EASL. They focused on a different population, a smaller population of 100 patients, but very well characterized because they were all alcoholic patients with cirrhosis listed for transplantation, and they analyzed the prevalence of metabolic fatty liver disease and the impact of fatty liver and with the coexistent metabolic risk factors that are overweight, obesity, and type 2 diabetes. And what they found here, as you can see, there was the prevalence of HCC in two groups, those with no steatosis, steatosis without metabolic risk factors, and metabolic risk factors with or without steatosis showed that these groups were those with the highest prevalence of hepatocellular carcinoma, and they also show that the tumor size was related to the presence of metabolic risk factors. tumor size is important, both in terms of prognostic value and in terms of treatment decisions for hepatocellular carcinoma. And in these slides, you can see very easily that the metabolic risk factors were the only factors really related to the presence of hepatocellular carcinoma with an odds ratio, so a risk that is 13 times higher than in the other patients, even with quite a large confidence interval, but still significant. So the authors concluded that the metabolic fatty liver may coexist with heavy alcohol consumption and is highly prevalent in patients with alcoholic liver disease undergoing liver transplantation, and that the previous exposure or metabolic risk factor, but not the concurrent presence, so the presence at the time of the evaluation of steatosis, was capable of increasing the hepatocellular carcinoma risk in patients with alcoholic liver disease. So in summary, these are, I think, the message for you. The first message is that high alcohol intake and high body mass index, so overweight, cause an increased risk of chronic liver disease among women, and that patients with alcoholic cirrhosis who are also overweight, obese, or have type 2 diabetes, so have metabolic risk factors, are more likely to develop hepatocellular carcinoma. Thank you very much.